I figured it out. I forgot to hit the go live button, guys. Oh my gosh. That was not good. Rookie move. Lester, we're not going out there right now, baby. Come lay down. Can you guys hear me now? Oh my. Just forgot to hit the go button. Oh my Lord. Okay. Yay. All right, guys. We've got 29 on and 3 likes on the YouTube. Yay. That's awesome. How's everybody doing this week? Did anybody get snow? And is anybody going to take their exam coming up anytime soon? This week? Next week? Something like that? Let me know in chat. Y'all can type away in there. Yes, in New York City. Woo! Yay, Yvette. Thank you for subscribing to the YouTube channel. That's awesome. I hope to have 100,000 subscribers by the end of the year. That would be awesome. I get one of those silver plaques from YouTube. If that happens, I'm halfway there, so that would be nice. No snow in Ohio. Aw, you're taking yours in March. COC in March. Maisha, make sure your sound is not going to Bluetooth devices. First week in March, CPC, awesome. Hey everybody. All right, let's get to our Word document for today. Get our first practice question up. Hope y'all got your brains on today. Let's see. What HIPAA level code category allows pass-through payment devices? Anybody got a clue? Sounds like one of those CCS questions. Any ahima people in the building that need some help with CCS questions today? Maybe they can help us answer this one. Thank you, Go-Car. You're awesome. February 29th, Erica. March 1st, Monica. We got A and the letter S. I've got C codes. C codes were introduced to report surgical supplies and drugs specific to procedures performed under the payment system, right, for Medicare. C codes report use of goods that Medicare will pay in addition to ambulatory payment classifications for a procedure. Only facilities using APCs can use C codes. C codes in our HIPAA book are pass-through payments. First week in March. Good job, Christine. A day before my birthday. Aw, you'll have a great birthday gift. Yeah, that would be great, Emily. Anybody ready for lab and path? Don't let all this stress you out. Concentrate up here on the very first CPT code. Don't look at the rest of this mess yet. Look at these first codes in the answer. Super helpful. Our first code is the 74 code. Let's go look it up because we need to know Do we add a modifier to it, or do we multiply it? That will help us move past and eliminate some answers. And you can tell that by going to the codes. So 8.3. Eight, 3, 8. 7, 4. If it's an add-on code, has a plus symbol in front of it, or has the word each in the CPT code descriptor, we can multiply it. If you look at code 83918, you can see that it's not an add-on code, but it does have the word each in the CPT code descriptor, and that's what I'm talking about. So, not seeing the word each or that this code is an add-on code, I probably would not multiply it. So any answers with that I could get rid of, right? Then would we use a 99 modifier or a 91 modifier? 99 modifier, is that the special lab one? And then our 91 is a repeat lab one. Were their tests done and were they repeated once every hour for 3 hours? What do you guys think the answer is? Let's give away some YouTube membership subscriptions while y'all are working on this question. Be sure and comment and chat. And if you're not a YouTube member yet, you can be gifted a month-long subscription. Looks like Padme, Christine, Siobhan, Tasha, were all gifted a YouTube membership. I hope those exclusive videos are super helpful. Of course, the workshops and the duck classes are super helpful. If you are fixing to take the exam in like the next few weeks, that's where you want to concentrate. Just turn the volume off on them. Wait for a question to come up on the screen. Hit the pause button. Go try to find the answer. Time yourself. Give yourself 120 seconds, maybe even 100 seconds per question. Try to pick out the answer, then release the video and see if you got the answer correct. It's a fast, efficient way to practice questions and get your timing up. You really have to be able to turn the book pages, find the answers, and build your skills for muscle memory, including your brain, to pick out these answers quickly. And those workshops are super helpful. Yep, 91 is the repeat lab. That's right. How do we do repeat labs? When we are doing a test, it looks like we've ordered 3 different tests, and we ordered them to be repeated once every hour for 3 hours. The correct coding sequencing for that kind of scenario will always appear like this. You will do a CPT code. Then when you repeat that test again on your second hour, you will write out the CPT code again in its entirety. Back to back, just like that. And then you will times the second one however many more times you did it with your 91 modifier to show that this is a repeat. It will always be this format. So when you have and are faced with a question with repeat labs, go through here and look for CPT codes presented and written out twice and then multiplied. This one with the 91 modifier. So we've got nothing like that going on here. Here we've got the same modifier or same CPT code, and then we've got the times 2. So that looks correct. That's the scenario we're looking for. This one doesn't look correct because we're timesing the first CPT code, and that's not how it's done. And this one is not how it's done either because we don't times the first CPT code. We times only the second time we write it. So anyway, B, of course, is correct. You will see the same CPT code written out twice with a comma in between. Then you'll do your timeses and your 91 modifier. Yep. Oh, Olivia, yay. Congratulations. Thank you so much for coming back and letting me know. Oh, I'm so glad you passed. That's great. Yay. That's awesome. I'm so glad I made a difference in your life, Olivia. That is great to hear. That's the best news ever for sure. There's your answer. We got more lab and path. Remember, don't read the question yet. If you're doing that, you're doing it wrong. Come up here to these first 4 CPT codes. Look at your differences between these codes. Then only search the question for those differences. One thing I might note is look for modifiers that look out of place. Do we normally use a 52 modifier in lab and path? Reduce services? That might have my alarms going off, and I probably wouldn't even look up answer A. But the rest of these, the 48 and the 47, are super close together. I'd go see what those differences are and then pick out my answer. What do you guys think the answer is? Aw, thank you, Olivia. Where you can practice all the exam questions is at the AAPC. If you're doing an AAPC certification, you go to the AAPC website. I just put the link in chat for their training and practice questions. You can purchase them all there. I recommend getting exams A, B, C, D, E, and F. And if that's not enough for you, you can always purchase the COC practice exam questions. Turn that down. And then also AAPC has a monthly magazine that if you are a AAPC membership, you get 20 free questions a month in their magazine with rationales, and that is the second link that I put in there, and those are free every month. Those are good questions, and they're from AAPC. They also have an area of study questions. If you fail your exam, you can go to your exam results, and on the very bottom of that page, you can purchase additional questions that are geared towards exactly what you did not do well in. Like if you only did not do well in guidelines and cardiology, you can buy an extra packet of just cardiovascular questions. It's really kind of cool. So those are super helpful. I have 3 quizzes on my website that are free that you can do these. They're at that link I just posted in chat. They're more like flashcards, things that I kind of want you to know off the top of your head. Like if I tell you the CPT code 99213, what should come to your head first? It should be office visit, established patient, right? If you see the code 99285, you should think ER, those kind of things. So I have 3 quizzes up for now on my website that are free that you can do there. So if we go to our panels, 800, the hardest part is with our exams being electronic, we don't have access to being able to draw a line through all these results and eliminate stuff and see how many are left over. So you're going to have to do all this in your head. If we did our basic, it has calcium ionized in it, which means we can get rid of this one. Our carbon dioxide we can get rid of. Our chloride we can get rid of. Our creatinine. Glucose we can get rid of. Hold on, my mouse just died. Yeah, put a new battery in that sucker. But luckily I got another standby mouse on standby. All right, then we get rid of our glucose, potassium, and sodium. Nitrogen. Good. Then we've got some stuff left over. We've got this one left over, this one left over, that one left over, and this one left over. So that's 1, 2, 3, 4 codes left over. This was the basic that I took everything off of, and then we had 4 additional extra codes. So that kind of looks right to me. The hard part will be practicing and doing these questions without being able to draw on your exam booklet. They don't give us the opportunity to draw on the online exams yet. I wish they would. They give you a chat box you can type to yourself, but that's unhelpful. If they would just give us a drawing tool where we can draw on the screen like this, it would be super helpful for the exam. But until we get that capability, yeah, we'll have to practice at home and do these questions within 110, 120 seconds each and pick out the correct answer. Best way to do it, of course, is to look one code at a time. Only focus on this. Don't try worrying about all the rest. Eliminate modifiers that don't make any sense. And get it down to just the two differences that are super close together. And that will help out a whole bunch. She's listening while she's driving home. Aw, thank y'all for the thumbs up. All right, guys, we've got two of them with the same answer. What's going on with this 970 code? Let's go look it up first because two of them are the exact same. I like looking for similarities. Sometimes it leads somewhere. Sometimes it doesn't, but a lot of times it does. So 909, what's going on with that code? 90970 is what? Are we in the dialysis area? That's for patients 20 years or older. We do have a 45-year-old patient, but what are they doing? They are doing, because it's a child code, we got to go look at mama. Mama code for this code is 90967. So you got to go look at 67 to see if you're here, because the age isn't going to be the only thing that's going to help you. Does this patient have end-stage renal disease, related service, less than a full month, per days, and if so, if we're in the right area, do we code it by itself or times 11? 66 is for home services, and then 60 home services for a full month. We just have to figure out if we did a full month or not. So it looks like we got 4 days in before the patient was admitted. Started on the 15th, went to the 19th, then the patient was discharged home. So we had 4 from here to here. Then we need to go from there to there. So that's 6 more days. Got to count the 15th. 15th, 16th, 17th, 18th, 19th. Yeah, that first number is supposed to be a 5 instead of a 4 because we got to count the 15th. That's how they got 11. So the 15th, if you count the 15th and the 16th, 17th, 18th, and 19th, you get 5 days. Then if you count the 25th through the 31st, you get 6 more days. That's how they come up with 11 days. Can we do 90970 as a times? is it in each? How can you tell? Instead of having the word each, its mama code, that 67 right there, has the word per day in it. That's just like the day, the other word each. Because mama has per day, and then the semicolon comes after it, that means every code underneath her, the 68, the 69, and the 70 are also per day. So you bill per day. That's how they got the 11. Yep. All right. We've got 2 of them with the 601 answer. Let's go look up that code real quick and see what is going on with that one. 99601. Home infusion. And again, 99601 says per visit. So we know these can be multiplied. We have a nurse that comes Mondays, Wednesdays, and Fridays. Each dialysis lasts 3 hours. Once a week, they also do preparing meals and stuff like that. How do you charge for a complete 30 days services for this? If the first of the month landed on a Monday, oof. Are we under the right thing? Home infusion, special drug administration, is that where we're supposed to be? Or should we be at the 99512 or the 90966 area? Or are we in the right spot? Yep. We got Monday, Wednesday, and Friday. For a month, for 2 hours, is our 99601 times 13. Then we need to code our O2 times 13 for our additional hour to equal our 3 hours a day that we did a month for this. Then we get to code for the Friday cleaning and shopping just once a week. That's why we have the 4 times 4 for once a week, times 4 weeks for a whole month of services for the 09. Yep. Perfect. Good job. Everybody got B? Good job. Perfect. Y'all are old hats at this. First thing I see is we've got some reduced services codes, modifiers here. And then we have the difference between 2 CPT codes. What's our differences between 93923 and 22? What do you guys have down as your one-word differences? 939, 22, and 23. What do you have as your one-word differences here? Checking up on chat. Good job, Stacy. Oh, sorry, Stacy. How can you tell what the mama code is for 67? I'll get to that in just a second. Sorry, I didn't see it. What do you guys have down as your one-word differences? Limited or complete? What if this question's not going to tell you whether it's limited or complete? They're just not going to tell you that kind of thing. What constitutes a limited procedure versus a complete procedure? What would you be looking for in the question? Yep, 1 to 2 levels, perfect, is limited, and then your complete is 3 or more levels. So you're just looking for the words levels and how many levels they did. Yeah, perfect. All right. What do you guys think is the answer for this one? The 52 modifier we wouldn't use, that reduced services, we wouldn't do that. We have an actual code for everything, so I'd get rid of those two. Now you just need to figure out how many levels you did. Good, we got that lower left leg. Yep. Yep. 1 level. Yep. Perfect. I don't know why I put 52 down there. I put the wrong one down there, I'm sure. I'm sure I was seeing things when I put the answer down. Ignore me. I was playing around. Copied the wrong thing. Did I already do this one? We did. We did this one. This is our myoglobulin, so that's a repeat. Here is the one I wrote for YouTube, I think this week. We have a difference between these codes are 11.6. 11.6 is our malignant lesions. Our 17.3 is our MAS. This one is a lumpectomy. And this one is cervical. What did we remove and how would we code it? we have a teaching provider who's doing a tumor. They made an incision. So they were removing a tumor. Where did they remove the tumor from? I had to go check on Travis. He was dropping stuff out of the refrigerator. Sorry, guys. Yep, and we only know it's breast because of lobules granular tissue. That's really the only indication to let us know that there is breast tissue that's being worked on. So sometimes during the CPC exam, they're not going to say the words that are in the CPT code descriptor. And you got to be pretty good with some of the English language a little bit to know what some of the additional AKA terms might be, or also known as. If they're not going to say breast, what would they say? And this is a good example of some words that you can write around, of course, answer B, to let you know that you can also look for those kind of words too, so you can figure out what the answer is. Yep. For sure. Here's some page numbers there for you. A complete ICD-10 PCS is present in what three parts? A complete is present in what three parts? The guidelines, tables, guidelines, or indexes. We have guidelines down twice. And then we've got tables. We've got index, and index. Sometimes it's nice to color code things because you can look for similarities, those kind of things. Got 3 indexes, guidelines. This would be really nice during the exam if you could have a drawing tool or a highlighter like we used to when we did the exams in person. And there's technology out there. They could allow this. I hope they do one of these days. Got another index. But you can see how index is in all 4 answers. Yep, 4 indexes. We kind of, sort of, almost have another tables, but not 100%. And then we've got changes versus descriptions. And because those just have bland, generic words in it, I'd get rid of those two, A and D. It's probably just a difference between B and C. And You just need to know, does PCS have guidelines or a list of codes? More for the AHIMA CCS people or COC people that are taking the COC exam. This one could be on your exam. What do you guys think? There's a really good video. Let's see. I don't know if I have it on this computer. Can't remember which computer I was on. Yeah, I'm not logged on. Not logged on. Hold on. I'm logged on. Why aren't you? I don't know. Let's see. I know I've copied that stupid link forever and a day. And then, of course, when I want to try to find it, I can't find it. Okay, you're going to have to go to let me switch back to this. You are going to have to go to this link on the AAPC website. Scroll down halfway down the screen. There's a video there, and they show you exactly what the online exam looks like, including screenshots from an actual real online exam, and it shows you how every piece of the exam works. You'll get to see the text box. It's just a notepad that you can type on. It does no benefit at all for the online exam. You don't need to type anything for the exam. You need to be able to draw on the exam, or highlight on the exam, but typing on a separate piece of paper on a square box on another screen isn't going to be helpful on the exam. But that AAPC does a really good job of showing you exactly what the exam's going to look like. B is the answer for that one. ICD-10 PCS is blank and self-contained. Is it compact, logic, categorized, or standardized? You're welcome. Right there, it is B. Tables, index, and list of codes. This one, what about that one? Checking on the kids. What do you guys think? Good job. Standardized. There's not a lot standardized in healthcare. There's a few things. ICD-10 PCS is composed of how many sections? Anybody know? Good for CCS, COC people. Gotta know how many sections there are. No, not C. Yeah, D, 17. Good job. There are 17. All right. Here's a good question. I don't think I've ever done this one before. When an autograft is obtained from a different body part in order to complete the objective of the procedure, what's coded? Do you code a separate procedure? Nothing. Autografts necessary to complete a procedure are not coded separately. A peptide graft that stays attached to the body are reported separately, or coding is dependent upon the size and nature of the graft. What do you guys think? When an autograft is obtained from a different body part in order to complete the objective of the procedure, yes, good job. We do A. We code a separate procedure. Good job. I think everybody got that one right. A procedure performed using an open approach with percutaneous endoscope assistance are coded how? How's the approach? Is it open, endoscope, open again, or percutaneous? What do you guys think? Procedure is performed using open approach with percutaneous endoscope assistance are coded to the blank approach. We have an open approach with percutaneous scope. a few little different. Oh, everybody's all over the bounce here. When using an open approach with percutaneous scope. If we cut open a body, are we going to say we're only going through the skin? Think of it that way. If you've already cut open the body and you're looking into the body with your own eyes, but we do introduce a scope later on that's just through the skin, is our whole procedure just going to be coded through the skin? Nah. We'll do open, right? Yeah. Yeah, Stacy, it's for COC people or CCS certifications. That's those guidelines. When the documentation of a procedure does not include a specific body part, the procedure should be coded to what? These are still really good questions, even if you're doing CPC, because you should know this. Because we've got a lot of things that happen to joints, especially in musculoskeletal, that we can only code a bone about because there is no joint codes. So you should know some of this kind of stuff. When a documentation of a procedure does not include a specific body part, the procedure should be coded to the closest body part to the procedure, intent, the anatomic region, an unspecified code, or none of the above. Ask the doctor. And D is not your answer. Now, what do you think the answer is? Do we have unspecified procedure codes a lot of times? Think about it. Do you see? I mean, in diagnoses, we have unspecified all the time. But in procedure codes, do we have unspecified a lot of times? So if I took away those two answers, which one do you think is right? We're looking for similarities too. These two answers really start off with the same info. They have a lot of the same, they have just as many words in them. If you're looking for similarities, you know, you'd get rid of C and D because they don't start off with the same stuff. These two really look very similar. You just need to know if you're doing the closest or region, really. And what sounds more medical? Region, right? There you go. All right. Back to hip picks. Somebody's been asking me to do hip picks practice questions. All we got to do here is look up our differences between our J0881 and our J0882. Look up those two differences and then see what your order was, how much was given, and then pick it out. Which answer is correct? What do you guys think? Maybe make it that way, a little bit easier. The other one is just so much information. You just took your exam, Diana? How did you do? What do you think? Was there anything on it you had absolutely no idea what was on it and it was just crazy, insane? Good night, Emily. See you later. Aw, darn ads. Anatomic region. I was talking about looking for the answers that look the most similar, right? And A and B look the most similar. You just need to know if you are closest or region. But B is the correct answer. And then this one, you are figuring up how much and which code, the 801 or the 802, is the right one for dialysis. Oh, due to snow. So they're going to do it again next week. Well, I went to the gym and I hurt my back last week on the rowing machine. Yeah, doing much better now. Yes, thank you, thank you, thank you. This one is B. Good job, Monica. It is B. Allergy testing. I hate allergy testing. Looking at these answers, 27 and 28 are the closest numerically. Let's go see what our differences are between those two codes, and then we'll see if we're in the right area. Let's see, 950. 950. Oh, 27 and 28. What kind of allergy testing did we do? What's our differences between the 90527 and the 90528? What do you guys have down as the one-word differences between those two CPT codes? They're both intracutaneous. They're both intradermal. They're both allergic extracts. So what's your differences? What do you have down? There was a question you didn't understand. Fingers crossed. Yes, yes, yes. Let me know what the question was. Question was first without contrast, and then with contrast and with stress. (27) you have down that it's airborne. 27 is timed or incremental, right? Where 28 is a delayed type reaction. They're looking for an immediate reaction on 27. What did we do today? We did the delayed type reaction, right? Delayed. So our answer for that one was this one. Okay. And she's saying 7. Seven, 5, 5, 5, 5. Your brain was probably mush by the time you got to the radiology section too. You've already done so much back here. By the time you get to these questions, 5, 5, 7, and 9. 5, 9 with the stress, and then 6, 3 with the stress. Yep. So 61 is your mother code. The 55561, it includes without and with contrast, and then the one with the study to go along with that would have been your 63. So if you had this done without and with contrast, with stress imaging, your answer would have been 63. Yep. So your answer should have been 75563. Unless your with contrast was only done orally or rectally, then it would have only been 5-9. You have to figure out what type of contrast was given, if known. But I think I found your question. So she's saying this question was on her exam today. Does that look familiar? Without contrast, followed by contrast, with additional sequencing and stressing. Mm-hmm. If this was your question, then yes, A would have been the correct answer. And there's some rationale to go with it. Not that it's really helpful. But in this particular question, A is the correct answer. Unless they said anything about the contrast going in rectally or orally. But if it's just left just like this, then A is the answer. You didn't have the ICD-10 codes, it was just the CPTs? Okay. Good job if you chose the 63. That should have been correct. Hey, Armana, what's your question? Bring it with the next one I got for tonight. The next question that I had was for atrial fib, if we are doing an implantable cardio defibrillator system and she returns to the clinic today for reprogramming, what is our CPT code? Correct. Correct. You don't even need to look up the diagnosis codes, nothing else. It's the only answer with that one particular 63 CPT code in it. If you found all those parts in that question, then move on to your next one. Correct. Do the ask about T's test, about open a heart. Those mess me up and I never decide what to get modifier. I've not had anybody say anything about it, a T's being on there. Well, I hope, Diane, that was your toughest one and you got it correct. So you had cardio 33250. 33250. I got a 49. Here we go. So we have our 50, our 54, 55, and 61. So ablation, ventricular, supra versus atrial. Two of those answers are atrial. One's ventricular, one's supra on those cardio questions. You had pulmonary vein. The only one that's vein would have been either 50 or 61. So that gets rid of 55 and 54. So it just depends on whether you're atrial, ventricular node, or reentry, track, or focus. So is it probably 61? Because 50 is more like an incision. And 61 is operative ablation. You're doing a whole operative ablation with bypass. So knowing whether you did a bypass or not is your difference, because 50 is without a bypass and 61 is with a bypass. That's another way to do that one easier, is just figure out if they're on heart-lung machine. If they were on the heart-lung machine, it's 61. If they were not on a heart-lung machine, it's 50. Thanks, Diana. Those are cool. Everybody saying A on this one? You guys are correct. Good job. What about this one? Got coronary artery disease. They're having a transpharyngeal echo study. Pulmonary vein. Right. Sometimes the facility charges one thing where the cardiologist might charge another thing or add modifiers. But this is a good question for COC people. I know I've got quite a few in here that are taking the COC exam coming up soon, so put in quite a few of those for tonight. Where is... Still got 37 of you guys. Oh, 40 of you guys in and 26 thumbs up on the YouTube video. Thank you much, guys. Love the support. Average duration is 17 minutes. I've been live for an hour and 20 minutes. That's neat. We got 5 new subscribers. That's cool. All these little stats and figures that they give us. Can you tell me 5 glucose? Yes, I can. So your glucose tolerance test, that was on your exam today, probably. Most likely, usually is on the exam. And in my notes, where's my camera? Is that it? Yep. We've got our answers for our 5 specimen glucose tolerance test. I've got the answer written down right there in my notes so that people don't have to guess. Just here. This has been on the exam. There you go. That's the answer. It's the 51 and then the 52 code times 2, because the 51 comes with 3 tests already. And then each additional specimen, you use the 52. So you had 5 in total. That does 3. This does 2. You add those together, that gets all 5. And I even put down common diagnosis codes that go along with it when they're utilizing those codes, just in case. $804. Yeah, the 2947 is, there's no strip involved in that particular code, times 5 stabs, or 0430. 2947 is quantitative with no test strips. And 80430. That's a human growth hormone. How much human growth hormone is stopped by blood sugars being too high is what's going on inside the 80430. So unless they were worried about human growth hormones and they did a suppression panel test, it's not going to be those codes. 830. 83003. Growth hormone again, another growth hormone. Five glucose tests and 5 growth hormones. That's what you're saying. (80430) does 5 growth hormones. 4, really? 4. It's doing 4 growth hormones and 3 glucoses. So 5 and 5. And the only 5 glucose specimens I know of is the glucose tolerance test, but you could do without the reagent strips. And then it says for antibody you do that. What other one? Let me see if everybody's got the answer to their question. It's on the screen, correct? Yes, everybody got B. Good job. All right, anatomy question. Okay. Diane, here's your answer if it was 4 of each one of those. Something like that. and the rationale to go along with it. I don't know if it'll fit. It probably won't fit, huh? It probably won't. I just have to show it on the screen. What did you guys get for this one? Everybody getting C? Okay. This is the rationale for Diane's question for her 4, not 5, but 4 of her growth hormone testy stuff and 4 glucose test. And then here's her test question. That's what the answer would have been if it was 4. 4 and 4. So look at your rationale. It says if an extra test are performed, these should be coded separately in the CPT code index. Right there. So would you times 2 that to make it, I don't know, make it the 5th? That'd be interesting. Here's y'all's next question. This one is for RSV shot. Thank y'all for the thumbs up. Y'all be sure and come back on Thursday. Twinkle's birthday is coming up this week, and she is going to be giving out YouTube subscriptions for her birthday month. So if y'all are here on Thursday night for our live, she's going to have bonus YouTube memberships to give out for her birthday. And Diana, you just won another YouTube membership. What about everybody else's answer for this next question? Yeah, Twinkle did it last year too. The dance is not on Valentine's Day. It is on, not this Friday, but next Friday. I thought it was a Valentine's Day dance. I don't know why I thought that, but it's not till next Friday. So I'll be live tomorrow. No worries. Sarah, you just won the membership. I hope that's super helpful. This is the question I always get. Was this one on your exam too, Diana? Are you a 73 or a 72? Figure that out first. The last code is the same in all the answers, so that doesn't matter. Just figure out if you're a 73 or a 72 first. Get you down to 50-50 shot, then you can deal with the rest. Can I explain 82270? That is a consecutive single plus CR neos. We're doing blood occult by peroxide activity, single, provided 3 cards for consecutive collection. We give patients 3 cards to take home, and they collect their own stool, put it on the cards, that kind of thing. The 72 code is other than. Usually for GI bleeds and stuff. No, not that one. Oh, 82270. Whoops. On our RSV, everybody got D? I saw that answer a bunch. Good job. 2 units are needed. What about this one for our numbness and tingling in the arms? We're going to be doing a Doppler waveform analysis with some other stuff. We have arteries. We have the modifier TC or not using it. Are we going to use it? Are we not going to use it? Those kind of things are crazy.
Greater than coding concepts include
Trying to copy and paste you something here, Diana. There is what they say. 82270 is reported for colorectal neoplasm screening, where 82272 is reported for other than colorectal neoplasm screening. If we're looking at the 93922, we need to know if we're going to add the TC modifier to it or not. 89339. 22. Limited. Bilateral again. And what procedure and diagnosis code are reported for facility services? Technical component. '26 modifier is for a physician to use and bill for them doing a report only and not being present and doing the procedure, but they're only looking at the films or whatever afterwards and just doing the report. TC is for a building to bill if they have some sort of special machine that nobody else has and they want to bill for their facility providing services for things. So TC is building, 26 is human being. That's the way I keep them straight. Well, diagnostic means we don't have a diagnosis, we're just going in, right, to look see. Therapeutic means we have a diagnosis and we're going in to fix something. Are you guys sure about that A? Look at your diagnoses. What did the patient have? What did they come in for? They had numbness and tingling in the arms, right? Where would numbness and tingling be? An M diagnosis, R diagnosis, or G diagnoses? Where would that be? Where's numbness and tingling? No, I don't think so, go-kart. There you go. Padme got it. Numbness and tingling leads you to what answer? So if you don't know whether you should use your TC or what else, then try looking at something else in the question to see if something else pops out that's easier. Numbness and tingling are symptoms, right? And those are always in the R section. So that makes it easier to pick out which one is your answer for this one. Don't get stuck on just having to only look at the CPT code. Sometimes you can let go of it and just go straight to the diagnosis code. So maybe it's a little easier. All right. We've got two of them that start out with the 58 CPT code. I'd start out by looking at that code, seeing what's going on there. Intervention. Are we doing intervention? Did we do an intervention today? Do you need interventions for panic attacks? You mostly think about interventions with people who don't think they need mental health, right? She's got cancer and she's having panic attacks. Seems reasonable. Doesn't seem like an intervention to me. So I'm not even sure if we should be in this section or not. So what is the 56 then? 56 is behavioral assessment. Or 60 is what? What's 60? That is an administration of patient-focused health risk assessment. Huh? No idea what that... I don't think administration is having to do anything. She's actually spending an hour and 15 minutes with a psychologist, and I don't think that has anything to do with administration. So I don't think she's intervention, and I don't think she's administration. So that just gives me the 56, and I would pick that and move on to my next question. Don't worry about checking and verifying your diagnoses and everything else. If you've already eliminated 3 of the other answers, then pick the one that's left over and move on with your next question. Don't linger. But C is your answer. That's for admission. Yeah. Admit. Patient-focused health stuff. That's silly. Definitely C. This one is one of those chemotherapy injection ones where you've got to do, some of them are push, and you know they're push because of their minutes. So if it's less than 15 minutes or less, then you know it's a push, and that anything that is longer than 15 minutes, then you're going to end up doing, that'll be your fusion minutes and hours. Sorry, so your start time to here, this is 1 hour. This one is 1 hour and 45 minutes. We've got, this one is 25 minutes. 25 minutes. All right, so what are our options for answers? We've got 2 that are 413 and 2 that are 360s. Do we start off 360s or the 413s? Look at you guys helping out in the chat. Remember, Diana, I said the 50 was without lung heart bypass, and 61 was the one with bypass. It could not have been 55 or 54 because those are arterial or aorta. Your thing says it's a vein, so it had to have been either answer 50 or 61. There wasn't enough in the question to let me know if you did a heart-lung bypass machine, but if you didn't, then the answer's 50. If you did do it, it's 61. Okay, the question up here. It's hard when I have it all. Let me see if I can't get it all on one page. Let's see, change the font size to something smaller. There we go. Yes. Drip is the same thing as infusion. Yes. You guys got it? Everybody saying A? Let's see. What are y'all getting? Okay, let's see. We've got, all right. What is going on with our 963, 60, and 61? The reason it's not A is because you can't have another parent code with the other two codes or other three codes. You have to do the add-on code for each additional hour for that 61. You would be setting up for a whole nother intravenous. This is initial. So you would be setting up for a whole nother intravenous infusion if you coded this one. And what we're doing is just adding on to what's already been started over there with the 413s, the 415s, and the 368s. So don't code. And that's what these parentheticals mean. It says don't code 60 if performed in concurrent with infusion services. You can't code it, meaning with code 413 and those other ones. We probably should add those CPT codes right there so you know not to do those. This code with those, you move on down and do these. Got it? Yep. That's that parenthetical that's underneath the 60. We can't use it. That's a coding irregularity. We can't do that one. Yep. There's your rationale with that one. There's your add-on. Yep. What is an example of what is not an example of an active treatment of a pathological fracture? ER encounter, surgical treatment, casting supplies, or treatment by a new provider? They're trying to be all tricky here. What do you guys think? If you are in a car wreck and you come into the ER and you're seen by an MD and you're treated for your fracture, what does that ER doctor normally do? They send you to a new provider to get treated for that fracture later on, right? So evaluation and treatment by a new provider is a good answer for what is an example of active treatment for a pathological fracture. So that's not a wrong answer. You're looking for a wrong answer. So D is not it. We just discussed ER visit. That's a good treatment for a fracture. So between B and C, what do you think is the correct answer? Anna, the last one's answer was B. There you go. Just some casting changes. Yes, that is your answer. Tricky question, right? Yeah, that one's crazy. Diagnosis codes. A lot of these are just, do you know the order that they should go in? 3 of the answers have this S code in it. Do you know if it's the only answer or if it's the second answer in most situations? Does this patient have 2 diagnoses, 3, 1? What's going on with them today? What got them out the door? Is a mass on their forehead, right? How do you code that? Which answer would be correct? They have foreign body in a mass. They're going to end up with 3 diagnoses for this one. Yep. Their foreign body in the soft tissue is going to be your M79. And then your laceration of the forehead is going to be the S code. And then their Z code is for the type of fragment that's inside their head. That was having metal inside your head. So they had a laceration, then they had metal in their head, and then they also had the foreign body, soft tissue. Yep. It's crazy. I would hate having to retain and find all these answers. with it not being multiple choice. Drive me insane. We are so lucky in the doctor's offices or hospitals now that we just use our EHRs to find out what the diagnoses are, and they make suggestions for us. To do this all paper form again would be a nightmare. All right, when it is documented that the patient is both using tobacco and has a dependence on tobacco, how is it reported? This is a guideline in the front of your ICD-10 book. Well, depending on which book you have, sometimes they're in the back. But if they both are using and have dependence to it, how do you code it? C is perfect. Good job, guys. Perfect, perfect, perfect. What about our I-25? Somebody was asking me last week about this particular diagnosis code. If a patient has coronary atherosclerosis disease and sees the cardiologist to discuss a bypass, this will be the patient's first cabbage. What is the ICD-10 code that is reported? When I look at these answers, I see that 3 of them have 6 digits and only 1 of them has 5 digits. I always like to count. Usually the 9s are non-specific, but not always. Things I think about. 2 of them have the 7 in them. What do you guys think is the answer? Code to the highest, yes, if it needed to be. I still don't see a correct answer. Everybody has this one wrong so far. Look again. They're trying to trick you. Don't let them win. There you go, Stacy. Stacy's the only one that got that one correct. It was the trick question where the smaller of the answer happens to be the correct answer. So really good example to write in your ICD-10 book to have. We just have coronary CAD unspecified. He didn't say where, when, how big, how, it's it. We just have it unspecified. It's crazy. Yep. It's our one answer with only 5 digits in it. You probably end up with one of these HIV questions on your exam if you have a patient who has had unprotected and has recently found out that one of them they were with has HIV and is being tested for HIV. What do you think the answer is? Are we 2 diagnoses or 1? And then we have 3 digits, 3, we have 4, or our combo one. Stacy's brain's working on all cylinders tonight. Indeed. I think she's very hyper-focused on passing this exam this time. Everybody saying B? B is correct. Good job. We are just screening. Yes, indeed. All right. This one might be on somebody's exam. I've been looking for something about somebody talking about her sister. Let me adjust this one. I think this one's 2 pages long. So there is a question on somebody's CPC exam. People have been reporting it for months. And it's talking about a sister, and there's some depression or something going on, but I thought there was a death involved, but I don't see a death in this question. But we're getting closer to finding the exact question that might possibly, maybe, doubt it, but we're close to what's on the exam. They're probably concerned with wanting to know order of operation. Would an F code be first? Would hypertension, diabetes, whatever the E code is, be second? And then what's third? Looking for what's in the correct order. We can see that we've got 3 answers with the E in the middle and only 1 without. And then we've got 3 at the end with the G's and 1 without. Kind of interesting. They all start off with the F31. We just need to know if we are a 12, a 62, an 89, or a 32, if possible. 3 of them end in 2, which is cool, but we still need to figure out the 3, the 6, or the 1. Let's see what her final diagnosis was for today. She was admitted for lithium adjustment. Diagnoses are moderate manic depressive bipolar with circular current manic state, hypothyroidism, and a migraine. That's a mouthful. I know a lot of these things you look up backwards, so if the diagnosis starts out with this kind of stuff, you look backwards What kind of condition is manic depressive bipolar? It's a disorder, right? So you got to look up that first, disorder, and then find your manic depressive bipolar stuff. Make sure your hypothyroidism is second, and then your migraine is on the tail end. And then our possible answers are right here. What do you guys think the answer is for this one? Thyroid's definitely going to be the middle code. We can get rid of B. Now that's the same answer all the way down. We don't have to worry about it. Now we've got 2 with the same answer here. So that made me want to get rid of C. So just the difference between A and D. Are we a 32 or are we a 12? That's what I would be looking at. What are those differences? There you go. Good job. Yes, D is it. Let me know what you got about migraines. I know we've got brand new codes for migraines too in the 2024 book. Now, whether they're on the exam or not, I don't know yet. No one has said that any of the new codes have shown up on the exam yet, so I guess we can be fairly certain no to that particular part yet, but that's all the questions I had prepared for tonight. So Stacy, let me know what you've got as a question. I do have a workshop this Sunday. We're going to do all surgical cases. If it has something to do with a patient being admitted and we're doing surgery on them, a guideline, a diagnosis, or a case, we're going to do 75 questions in those areas. This Sunday, if you want to hang out and do 75 questions with me for 3 hours, you can. The link is up on my website at medicalcodingbyjen.com. And just go to workshops and you can book it there. If you can't attend and you just want to watch the replay, you can pre-purchase that and have access to it for 90 days. No worries. In 90 days, it will go to the YouTube members and then they'll be able to watch it. I'm reading chat. What's her question? If a patient has a history of migraines, is it as history code migraines? History code, Stacy. Yeah. I take your exam tomorrow. Oh, you're taking your exam tomorrow? Hold up. I got some more info for you then. If you're taking it tomorrow. Boy, yeah, Diana's info that she gave you was super helpful because she took it today. That's great. if you're taking it tomorrow, whoops, wrong one. That one. Be sure, I know you've probably heard it before, be sure you know what the Skene's gland is. It's a lesser female gland. This vocabulary term, L-U-N-U-L-A, Warthin's tumor, it's an oral salivary gland tumor. O-S means cervical. Phalanges, know what those are, what connects bone to bone, parts of the shoulder, parts of the knee. ESRD, be sure you know what that stands for, end-stage renal disease. If you have the 2023 CPT book, pages 368 and 53 are important ones on the exam. Know the difference between ALS and BLS ambulances in the HIPICS book. Short arm, long arm cast, depending on whether it's fiberglass or whether it's plaster supply, that kind of stuff. There's that sister psych question that we've been talking about. And if there's an adverse reaction with the patient, the answer has the 6th digit in the diagnosis code will be a number 5, and that will be the correct answer. Super helpful. Know that in integumentary, if anything is a 114, it's benign. Anything that's a 116 is malignant. And this particular vocabulary word, TRICH, and know what each individual letter stands for HIPAA or NCCI, what each individual letter stands for. Super helpful to know that kind of stuff. And best of luck. Get some rest. Try not to stress. I'll be back tomorrow on TikTok. We'll do 2 hours of questions and Q&A and book prep. And we'll be back here on YouTube on Thursday for 2 more hours of practice exam questions. But I hope to see you guys on Sunday too. Where would you start if this was new and Greek to you? I would recommend going to Google, doing a Google search, and just finding you the cheapest CPT book you can find. I'm trying to get the camera to work right. From AMA, either a 2023 or a 2024 version with free shipping. Try to find one as cheap as you can through a Google search with free shipping, and then go to my website, medicalcodingbyjen.com. Go to the page under resources that says CPT book prep, and do everything on that page that I tell you to do. Just start going through the book and doing everything that I tell you, like marking every one of your do nots in the book, every one of your do's in the book, highlighting exactly what I tell you to highlight throughout the entire book. It's tedious, but it's going to help you, I promise. You're going to build skills doing all of this, all my little steps. You're going to circle everything that says closed in orange. You're going to circle everything that ever says open in green. You're going to go to the cardiovascular system, and you're going to mark everything that says aorta in red and everything that says ventricular vein or venous in blue. All these little steps are going to help you pass the certification exam. You may not know what the heck you're doing or why you're doing it, but I promise all these little steps that I have outlined for free on my website are going to help you. Start out with the CPT book. You're going to get intimate and familiar with this book. You're going to order you some of these pens. I just got me a new batch in from Amazon. They're $6. Bic Intensity. The 0.4 millimeter. Let me get the camera going on here. With free shipping, the 0.4 millimeter Bic Intensity Bold Colors pens. And we use the greens, the oranges, the blues, of course, Anytime a CPT code descriptor says the word without, you're going to put one line through everything that it's without. There's a lot of steps there on my website. You're going to go through and mark every one of these do nots. This is where I would start. Then when you get done with that, there's more stuff on that page that shows you how I go about updating all my anatomy pictures. You're going to go to Google and you're going to do exactly what I did. You're going to write down the function of everything that's labeled by doing a Google search. What does it do? Like the epiglottis, it protects the trach from inhaled food. That's exactly what it does. And I just went to Google and found it and wrote in my own words what it does. No big deal. You're going to do that. You continue to do that. Get done with all the steps. And keep meeting me here on my free lessons 4 nights a week if you want to, and continue listening. Watch me do practice exam questions. When I tell you to go to your books and make notes of whatever I'm doing, then do it. But just keep watching me for free and go to my website, get you a CPD book, and just do everything I said to on the website, and it's all for free so that you can just get started and get familiar. I'm working on the 2024 notes now, going through the book all in its entirety again, going through and underlining all the do nots, all the do's, fixing all of those out of code sequences by putting down the page numbers of where the code is because it's been misplaced. Normally the codes are in numeric order, which is great, but sometimes they move them around, and all you need is the page number. They give you some crazy references that are sometimes 700 pages that you got to go look through to find them. I don't know why they just don't put the page number down where it's located, so you got to go do that. But marking all these differences is super helpful. So if you have this code as a possible answer and this code, well, you know right away your differences are circled because I told you what to circle. This one's a vein and this one's arterial. So if it's just a difference, all you got to do is go through your exam question, see if you're in a vein or if you're in an artery. Pick your answer and move on. There's a purpose for all of it, and it is super helpful, but it is tedious. But it's if you want to pass without a college course, fastest and most efficient way possible, I got you. And the crazy thing is if you go through a course and you learn this old antiquated way of medical coding through these paper books, and then you do take your certification exam, and then you do pass, well, when you get in a job situation, you got to throw away everything you just learned about all this paper stuff, because they got to teach you how to do it on an EHR system, which is totally different from what they taught you in this $3,000 course you just paid for. So you're going to have to relearn something anyway when you get on the job. Just pass the exam and then get on the job and learn something new. You'll be fine, I promise. That's my best advice, is just hang out with me on YouTube and TikTok, and go get you a CPT book and get started with all my little steps. I hope that's helpful. Wouldn't that be just helpful? Just add the darn page numbers. Yeah, Amazon does have some ICD-10s, and sometimes the CPT's cheap. I like the bookstore Book Run. They're on eBay, but they have sent me last year my 2023 books. I got 2 of them from them. I should have bought them out, but I got 2 of the 2023 at the very beginning of the year for $50, free shipping. It's great. All right, guys. I hope that is helpful. I will see you guys again tomorrow night on TikTok. We'll be starting around 6:30 Arizona time zone. I'm proud of you guys. Love you. I will see you tomorrow night. Hope this was helpful. Thank you. We'll see you again. Oh, you're welcome. I hope the membership helps. I hope those YouTube videos are just great. It doesn't matter which level you purchase. You can support by buying whatever level you want if you do purchase the YouTube memberships, but everybody gets access to everything, even if you have the $4.99 a month membership. So if you decide to do get a month, you can cancel anytime, and that's awesome. You're welcome. All right, guys. See y'all tomorrow night on TikTok.